आज चाहिँ हामी मस्कुलोस्केलेटल नै MSc MBBS फर्स्ट इयर सेकेन्ड पार्ट मस्कुलोस्केलेटनको हामी सोल्जर एनाटोमी पढ्न जाँदैछौँ है। सो सोल्जर एनाटोमी पढ्नु अघि सबभन्दा बेसिक कुरा चाहिँ थाहा हुनु पर्यो है। सो दिस बोन इज द क्लेभिकल है। सो सुरु गरिहालौँ। So this bone is the clavicle. Okay, this is the clavicle, and this is the humerus, and this is the humerus. Okay, this is the humerus. Okay, and the remaining is the scapula. So this is the clavicle. सबैलाई थाहा छ त्यही पनि है. This is clavicle. This is the humerus, and this is the scapula. Okay, so clavicle को पनि दुईटा अब साइड डिटरमाइन गर्ने हुन्छ. त्यसको लागि छुट्टै लेक्चर चाहिँ आउँछ है. अहिलेको लागि चाहिँ यति बुझिराख. This is the lateral side of the clavicle. This is the lateral side of the clavicle, and this is the medial side. So medial side articulates with the manubrium of sternum to form the sternoclavicular joint. It articulates with the manubrium of sternum to form the sternomanubrial joint. Manubrium joint. Or this size घटाउँछु. Sternomanubrium joint, which is a type of the saddle variety of synovial joint. So this is the sternomanubrium joint, which is a saddle variety of synovial joint. This is a saddle variety of synovial joint. Okay, so this is the medial end of the clavicle, and this lateral end of the clavicle articulates with the acromion to form a acromioclavicular joint. So is the lateral side of the clavicle is a plane. So lateral side of the clavicle is flattened plane. So it is a plane synovial joint. It is a plane synovial joint. This is a plane synovial joint. Okay. So the medial end articulates with the sternum to form sternoclavicular joint, which is a saddle variety of synovial joint, and the lateral end of the clavicle articulates with the acromion of the scapula, acromion process of the scapula to form acromioclavicular joint, which is a plain synovial joint. So in the posterior side of the scapula, there is a prominent process. There is a prominent process called this process is called the acromion process. This is the acromion process. Okay, and in the anterior side there is a prominent another process of scapula. There is known as coracoid process. Okay, coracoid process, and the clavicle has another prominent process, or this is known as spinous process. Spinous process, or simply called spine of scapula. Simply called spine of scapula. Okay, and this spine of scapula divides the posterior surface of the scapula into two parts. That is the superior part. That superior part above the spinous process is known as supraspinous part, and the part that is below the spinous process is known as infraspinous part. So in the supraspinous part and the infraspinous part, there is a depression called as supraspinous fossa, and there is another depression in the infraspinatus part, that is infraspinatus fossa. Okay, so supraspinatus and infraspinatus fossae. So scapula has three borders, as you can see. These three borders, that is the superior border. This is the superior border. Okay, this is the superior border. See it. This is the superior border. This is the superior border. Okay, this is the superior, and this is the medial. This is the medial because it lies to the medial side of the body, and this is the lateral border. So scapula is a triangular in shape. So this is the scapula, general representation of scapula. This is like a triangle. So A triangle has three sides. So this is the superior border of scapula, and this is the medial border. And this is the lateral border. Okay. So there are three sides and three angles. Okay, this is the lateral angle. This angle is the lateral angle. This angle is the lateral angle. So lateral angle, and this is the superior angle, not medial. Superior angle, and this is the inferior angle. Okay, inferior angle. So there in the lateral angle there is a cavity called as glenoid cavity. So glenoid cavity articulates with the head of humerus, as you can see in here. This articulates. This is the glenoid cavity. This glenoid cavity articulates with the head of the humerus to form the glenohumeral joint. This is the glenohumeral joint. This is the glenohumeral joint. Okay. As you can see, this is the glenoid cavity. This is the glenoid cavity. This is the glenoid cavity, and it would articulate with the head of the humerus. This is the head of humerus to form a glenohumeral joint. Okay. Okay. Okay, so this is the front view, and there is the anterior side of the scapula also has a fossa or depression. This is fossa or depression is known as, this is subscapularis fossa. Subscapularis fossa. This is also a depression. This is subscapularis fossa. In the anterior side of the this is the coracoid process, and there is a notch present. Okay, there is a notch between the base of the coracoid and the supraspinatus part. This notch is known as the suprascapular notch, suprascapular notch, from which the suprascapular nerve passes, Okay, so let's go to the basic anatomy of the humerus. So there is the head of the humerus. There is a head. So this head is called the anatomical head because it articulates with the glenoid cavity. So this head is the anatomical head. This head is the anatomical head, and there is something called a surgical neck or surgical head. This is the anatomical neck, and this is surgical neck. So anatomical head is simply the that portion of the head of the humerus that articulates with the glenoid cavity, and the surgical head or surgical neck is the point from which the head of humerus joins the shaft of humerus. So this is the point from which the head of humerus joins the shaft of humerus. Okay, this is the head of humerus. This is the head of humerus, and this is the shaft of humerus. So this is a surgical neck, and there is something called as morphological neck, just above approx 0.5 centimeter above the surgical neck. There is the morphological neck also. So this is the morphological neck. So there are three necks, and you can see there are two bony projections in the anterior surface of the humerus, head of the humerus. This bony prominence. Bony projection. This bony projection is known as the greater tubercle. Okay, this bony projection is known as the greater tubercle. Okay, the greater tubercle, and this another bony projection that is known as the lesser tubercle. So lesser tubercle lies towards the medial side, while the greater tubercle lies towards the lateral side, and between these two tubercles there is a depression or groove. As you can see, there is a depressed part. Okay, this is the depressed part. So this is the depressed part, as you can see. So this is between two tubercles. So this is known as intertubercular groove. Intertubercular groove or sulcus. Okay, sulcus. Intertubercular groove or sulcus, and there is a tendon in this groove. So the long heads of biceps brachii. Biceps brachii is a muscles of the arm in the anterior compartment of the arm. So long head. So the biceps brachii has two head. One is the long head that arises from the supraglenoid tubercle. Okay. So glenoid cavity. So glenoid cavity, there is a structure above the glenoid cavity known as supraglenoid tubercle. So from there the long head of biceps brachii originates, and it passes through the intertubercular sulcus. So this is the intertubercular sulcus. It passes through the intertubercular. So supraglenoid tubercle is here. Wait. I will tell you. Okay, supraglenoid tubercle is here. Here, supraglenoid tubercle is here. From here, the long head of biceps brachii. Long head of biceps brachii. From here, long head of biceps brachii originates, and it will come in the bicipital group. And this bicipital group, so this is the intertubercular sulcus. So intertubercular sulcus contains the long head of biceps brachii. So it is also known as the bicipital group. Okay. So this is the long head of biceps brachii. This green structure, this green colored structure is the long head of biceps brachii that passes through the intertubercular sulcus. So this structure is also known as the bicipital group. Okay. So यति भयो है. So अहिलेको लागि यति नै जानिराख्नु अरु केही छ छैन. So there is a posterior surface of okay. There is also posterior head. So you can see there is a posterior head. So in the posterior part of the greater tubercle, you can see a facet. So this is the superior facet, and this is the middle facet, and this is the inferior facet. Right? These facets are the important attachment for the muscles of the shoulder joint. These are the rotator cuff muscles from the posterior side that arise from the posterior part of the scapula. So these three facets. So these three facets are the attachment side for the rotator cuff muscles from the posterior side. Right? So these are the facets. Okay. अब यसपछि गएर तल आउँछ है. So basic structure of the joint है, shoulder joint को structure मा shoulder joint is supported by, so any joint is supported by the ligament है, for stability. So ligaments are there. So there is this is the coracoid process. Okay, this is the coracoid process. This is the coracoid process, and this is the acromion process, and this is the clavicle. Okay, this is the clavicle. This is clavicle, and this is the humerus head. This is the humerus head, and this is the lateral border and the lateral angle. This is the lateral angle of scapula. So as I said, there is a tendon of long head of biceps brachii. So this is the tendon. This is the tendon. This is the tendon of biceps brachii, long head of biceps brachii, that passes through this depression structure. Right? This depression, this is called as the intertubercular sulcus, or simply called as the bicipital groove. And the ligamentous support. Okay, so there are the many ligaments that connects. Okay, that is the acromion, and this is the clavicle. So the acromioclavicle joint is a plain synovial joint which is again covered by a ligamentous structure known as the acromioclavicular ligament. This is the acromioclavicular ligament acromioclavicular. This is the acromioclavicular ligament, and there is another ligament that attaches the acromion process and the coracoid process, that forming the superior arc. Superior arc is a semi-arc, like this semi-arc, superior arc-like structure about the superior aspect of the shoulder joint. This is shoulder joint. This is shoulder joint. Okay, shoulder joint ko superior aspect ma there is a ligament formed between the acromion, and this is the coracoid. So that form the superior arc above the joint. So this is known as the acromioclavicular ligament, because it arises from acromion, and it is between the acromion and coracoid process. This is known as acromiocoraco ligament. Acromiocoraco ligament. Coracoid ligament, simply acromiocoracoid ligament, acromiocoraco ligament or acromiocoracoid ligament. Okay, so that form the superior arc that protects the shoulder joint, from that prevents the superior dislocation of the shoulder joint. So that form the arc, and there are the ligaments that arises from the coracoid process and inserted into the clavicle, that gives stability to the clavicle during the shoulder movement. Shoulder move गर्दाखेरि यस clavicle लाई stable राख्नको लागि चाहिँ there is the coracoclavicular ligament. This is the coracoclavicular ligament, and this is the coracoacromial ligament or coracoid ligament. Simply, we can call it as like that. Okay, this is the trapezoid part. This is the trapezoid part, and this is the coronoid part. So coronoid part this is the coronoid ligament. So this is the coronoid ligament, and this is the trapezoid ligament. Eh? So there are two coracoclavicular ligament. That is the on the lateral side there is a trapezoid ligament. This is trapezoid ligament, and there is the conoid ligament. Conoid ligament. Not coracoid, and not coronoid. This is the conoid. त्यो तीनटा कुरा हुन्छ कि एनाटोमीमा कोराकोइड भन्ने हुन्छ है कोराकोइड कोनोइड भन्ने हुन्छ र कोरोनोइड सो कोरोनोइड तिमीले फोरआर्म पढ्दाखेरि आउँछ है फोरआर्म पढ्दा कोनोइड इज हियर this is the conoid ligament and this is the coracoid process. So this process is the coracoid process, and coracoacromial ligament is the conoid ligament and the trapezoid ligament that has the coracoclavicular ligaments that help to stabilize the clavicle during the movement of the shoulder joint. Okay, so in the lateral view you can see, and also these are the joint capsules. Okay, these are joint ligaments. These are the glenohumeral ligaments, also known as these are the glenohumeral ligaments. So glenohumeral ligaments. These are the glenohumeral ligaments. So in the superior aspect, these are superior glenohumeral ligaments, and there is a middle glenohumeral ligaments, and there is a inferior glenohumeral ligaments. So there are three glenohumeral ligaments: superior, inferior, middle. Okay, so glenohumeral ligaments, and there is also one ligament called ligament of coracohumeral ligament. This is a coracohumeral ligament that arises from the base of the coracoid process. This is the base of the coracoid process. And that get inserted in the greater tubercle of the humerus. So this form the coracohumeral ligament. So these are the ligaments of the shoulder joint. So in the lateral aspect, so you can see there that the muscle tendons inserted in the humerus. So these are the muscles. So these are the anterior muscle is the subscapularis, and there are also many other muscles like latissimus dorsi, teres major, pectoralis major. So this will be taught later in the arm section, and you can see that these are the muscle that covers that rotate that covers the shoulder joint. Shoulder joint like cover गर्ने हुनाले यिनीहरूलाई चाहिँ so also called as the rotator cuff muscles. These are rotator cuff muscles पनि भन्छ है. So rotator cuff muscles, there are 4 rotator cuff muscles. That is the supraspinatus. This is the supraspinatus, and this is the subscapularis. This anterior muscle is subscapularis. This superior posterior muscle is the supraspinatus, and that is present in the supraspinous fossa, which is above the crest of spine or simply spine. And there is infraspinatus muscle, which is present in the infraspinous fossa, and there is a teres minor that is present on the lateral and inferior angle of the lateral, inferior and posterior angle of the teres minor. And there is the long head of biceps. Okay, so this is the anterior muscle. So this passes through the intertubercular sulcus or basipital groove, and there is the anterior muscle of the rotator cuff muscle that originates from the subscapularis originates from the subscapular fossa. Subscapular fossa. So there is subscapular fossa on the anterior side of the scapula that gives origin to the subscapular muscle, and this is inserted. In the lesser tubercle of humerus. So lesser tubercle of humerus, This is the lesser tubercle of humerus, and this is the subscapularis fossa. Okay, this is the subscapularis fossa. So this muscle originates from here, subscapularis fossa, and is inserted into the lesser tubercle of the humerus. So this is the greater tubercle, and this is the lesser tubercle. So this is the anterior side of the anterior rotator cuff muscle that forms the that helps to stabilize the shoulder joint. And there are posterior rotator cuff muscles known as supraspinatus that arises from the supraspinous fossa. supraspinatus that arises from supraspinatus fossa, and the infraspinatus that arises from this infraspinatus fossa that arises from infraspinatus fossa, and the teres minor that arises from the lower posterior border of the scapula, lower posterior border of the posterior, and this is lower, this is posterior, right? This is posterior, and this is the lateral, right? Lateral border, right? This lateral border, right? Border of scapula को lower posterior lateral border matter, and is inserted, inserted here are the अन्य मैले facet को कुरा गरिरहेको थिएँ नि, so these are the facets. So this is the superior facet. So supraspinatus inserted in the superior facet, and there is a medial facet just posterior to the greater tubercle, where the infraspinatus is inserted, and there is an inferior facet known as where the teres minor is inserted, right? So यसको insertion पनि भयो. Okay, so this is the crest of spine. Okay, this is the crest of spine. This crest of spine, or simply scapular spine. So this spine divides the scapula into supraspinous fossa and infraspinous fossa. So अघि नै कुरा गरिसके यसको चाहिँ है. So same figure, है, same figure अलि anatomical देखाउनु पर्दा. So this is the crest of spine. This is the posterior view, है. So this is supraspinous that inserted into the superior facet, and there is infraspinatus that is inserted in the middle facet or intermediate facet, and this is teres minor that was inserted into the inferior facet. Okay, so supraspinatus individually, this is originated from the supraspinous fossa. This supraspinous fossa, because this is the spinous process and this is the crest of spine. So supraspinous fossa bata origin bhaera it was inserted into the superior facet because it lies superior to the head of humerus. So this is the head of humerus, and this head of humerus goes superior aspect machanda. So there is a inferior, so middle or intermediate facet, and there is a inferior facet. So in your middle ma there is the insertion of the infraspinatus, and the inferior ma teres minor, right? So teres minor. So as you can see, this muscle originates from the infraspinous fossa and is inserted into the this middle facet of the humerus that is just posterior to the greater tubercle, and there is also a teres minor originating from the inferior lateral and posterior border of the scapula and inserted into the inferior facet, this inferior facet. Okay, so these are the basic rotator cuff muscles of the posterior side and the rotator cuff muscle of anterior side that originates from the subscapular fossa and inserted in the lesser tubercle. Okay, these are the 4 rotator cuff muscles. So there are 4 rotator cuff muscles. This is the crest of spine. So मैले कता कता naming गर्न लाग्थे. So this structure. This is the intertubercular sulcus. This is intertubercular sulcus. Sulcus are also known as a bicipital group. Bicipital group. So this is the, and अरु naming छ कतै. Okay. अरे Okay. आयो ल. This is the clavicle. Hey, this is the clavicle. Okay, this is the acromion process. This is the acromion process, and this is the, okay, there is the insertion of in the inferior facet. This is the inferior facet. Okay, there is the origin from the lateral posterior and inferior border, lateral posterior and inferior border but origin huncha. So inferior just above the teres major, just above the teres major. So teres major ko origin So teres major originates just below the origin of the teres minor. So this is the origin of teres major, right? So again this is the greater tubercle, This is the greater tubercle, and this is the lesser tubercle, and this is the bicipital group. bicipital group. So the bicipital group, and there is the insertion of the teres major. Okay, I said teres major, so teres major is originated just below. So this is the origin of the teres minor. This is the origin of teres minor. So this is the origin of the teres major. Okay, so teres major origin is just below the teres minor, and that goes towards the anterior side. Okay, this goes towards the anterior side of the humerus, not on the posterior side. Goes towards the anterior side of the humerus to get inserted into the medial lip. Okay, this is the medial lip. So intertubercle sulcus has two lips. This is the lateral lip. This is the lateral lip. Okay, this is the medial lip. Also, teres major is inserted in the medial lip, and this is the insertion of teres major to the medial lip of this is the medial lip. Medial lip of bicipital group, and there is an insertion. This is the lateral. This is the okay. So this is the lateral. This is the lateral. This is the lateral lip. So lateral lip, and this is the floor. Everyone has a floor. The lateral lip or floor of bicipital group. Floor of bicipital group. So bicipital group को floor, medial lip or lateral lip तीनटैमा चाहिँ there is the origin there is the insertion of the muscles. So medial lip there is the insertion of the teres major, and there in the lateral lip there is the insertion of the pectoralis major, pect major. This is the pect major, pect major, pectoralis major, and in the floor of the bicipital group there is the insertion of the latissimus dorsi, latissimus dorsi, latissimus dorsi. So latissimus dorsi inserted into the floor of the bicipital group. In the lateral lip, pectoralis major is inserted, and in the medial lip, the teres major is inserted. So, so this can be remembered as the lady between two majors. Lady between two majors. Okay. So there is the on the lateral lip. This is the lateral lip, and this is the medial lip, and this is the floor. Okay. This is lateral lip. This is a pect major. Pect major, this is pect major, and in the medial lip there is a teres major, and on the bicipital group or on the floor there is latissimus dorsi, okay. So this can be remembered. La means a lady between two majors. So there is laterally there is pectoralis major, medially there is teres major. So is the human boy. So this is the origin of this is near the inferior angle, near the inferior angle or posterior inferior angle, origin insertion by this is the head of humerus, okay, and this is the anterior view, anterior view area this is the articular cartilage, shoulder joint layer, so this is the articular cartilage, this is the hyaline cartilage. That helps in the movement of the shoulder joint, and there is also articular cartilage in the glenoid cavity. So these are articular cartilage. So shoulder capsule of the shoulder joint is covered by synovial membrane everywhere except in the part of the articular cartilage. So this articular cartilage but how much synovial membrane छैन अरुमा चाहिँ छ this articular cartilage भएको ठाउँमा छैन. So this is synovial membrane. Synovial membrane यहाँ छ हेर है. So this is synovial membrane. So articular cartilage मा हुँदैन अरु सबैमा हुन्छ है. So this is the synovial membrane. This is the synovial membrane, and which is further supported by the inferior glenohumeral ligament. This is the inferior glenohumeral ligaments. These are the inferior glenohumeral ligaments, and this is the tendon of the muscle supraspinatus that are inserted into the superior facet, and there is a bursa. Okay, this is bursa. Okay, this is bursa are specialized structures that helps to reduce the friction. Okay, this helps to reduce the friction during the movement of the shoulder joint. So it is just below the acromion. So just below the acromion, so it is known as subacromial bursa. And in the muscle just below the deltoid, there is another bursa called as subdeltoid bursa. And this is the greater tubercle. Okay, so glenoid cavity, glenoid labrum. Okay, glenoid labrum are the fibrocartilaginous rim. Okay, these are the fibrocartilaginous rim. Rim means the outer covering that
depends the glenoid cavity for proper articulation of the head of humerus to the glenoid cavity. As you can see, the glenoid cavity is smaller and the head of humerus is the bigger structure. So for the proper articulation, so in this fibrocartilaginous rim, the glenoid labrum depends the glenoid cavity that forms a proper ball and socket type of the synovial joint. That helps to stabilize, that also helps to stabilize the shoulder joint. So glenoid labrum depends, so it will depends the glenoid cavity. So glenoid cavity like depend goiro बनाउँछ. So for proper articulation with the head of humerus. So same figure. So this is the coracoid process, and this is the acromion process. So this is the in the superior aspect of the head of humerus, there is insertion of the supraspinatus. So supraspinatus tendon, so muscle is inserted into the bone with the help of tendon, and then in the medial facet there is the
Okay. Okay. In the middle facet there is the insertion of the infraspinatus. This is the infraspinatus tendon. This is the infraspinatus. This is the supraspinatus tendon, and there is also the tendon of the teres minor. So this is the tendon of the teres minor. So these are the joint capsules, joint ligaments. These are joint capsules or joint ligaments. So this is the medial glenohumeral joint. Okay, this is the inferior glenohumeral joint, and this is superior glenohumeral joint. This is superior glenohumeral joint, and there is another rotator cuff muscle of the anterior side. There is the subscapularis muscle tendon. Okay, there is subscapularis bursa, also subscapularis bursa or subtendinous bursa of subscapularis, also known as subtendinous bursa. Subtendinous bursa. So okay, so there is the glenoid cavity. This is the glenoid cavity. This is the glenoid cavity, and this is the glenoid labrum. Glenoid labrum that depends the glenoid cavity, and this is the long head of biceps brachii, and this is the tendon of the biceps brachii. Okay, this is the basic structure of a shoulder joint. So glenoid labrum भयो. Okay, glenoid labrum, glenoid cavity, synovial membrane, all the synovial membrane. So in this figure you can clearly see that the supraspinatus fossa contains the supraspinatus. This is the infraspinatus. This is the teres minor, and this teres major. So teres major, this is long head of triceps brachii. This is the lateral head of triceps brachii. This is the long head of triceps brachii. This is the lateral head of triceps brachii. This is teres minor. Teres minor is here. Teres minor. Okay, teres minor. And teres major. Okay, teres major. Okay, this is the muscle. Okay, so in the anterior side you can see that there is a subscapularis. Okay, this subscapularis inserted into the lesser tubercle. This is long head of biceps brachii, and this is the intertubercle sulcus in the bicipital group. Okay, this is the short head arising from the coracoid process. This short head and this long head. Okay, so and the rotator cuff muscle. Okay, let's go to the rotator cuff muscles. There are the four rotator cuff muscles. There is supraspinatus, infraspinatus, teres minor, subscapularis. Okay, the supraspinatus muscle originates from the supraspinous fossa of scapula. Infraspinatus muscle originates from this infraspinous fossa of scapula. Teres minor originates from the lateral border of the posterior side of scapula. Subscapularis muscle originates from the subscapular fossa of scapula. Okay. So fossa भनेको खाल्टो depression. Okay, so insertion in the greater tubercle of humerus. So in greater tubercle, so these facets are present just behind the bony prominence, bony projection को behind मा हुन्छ. So this is also the part of the greater tubercle. So greater tubercle यो superior facet. This is superior facet, this is the medial facet, this is inferior facet. So tinta muscle भयो, this originate into the lesser tubercle of humerus. So supraspinatus, as you can see that supraspinatus is present in here. So when it contracts, यो contraction भयो भने यो हात चाहिँ माथि आउनु पर्यो नि त, किनभने यसलाई तान्छ नि त, तान्ने हुनाले चाहिँ यो हात माथि आउनु हुन्छ के. So this helps in abduction. This helps in abduction of arm, and the infraspinatus is present in there.
हैन यो यो इन्फ्रास्पाइनटसले चाहिँ हातलाई पछाडि तान्ने भयो है सो द्याट विल हेल्प इन द ल्याटरल रोटेसन है इन्फ्रास्पाइनटसले ल्याटरल रोटेसन अफ आर्म सो टेरिस माइनरले पनि ल्याटरल रोटेसन अफ द आर्म एन्ड सब स्क्यापुलर चाहिँ भित्र हुनाले त्यसले चाहिँ भित्रतिर तान्ने भयो त्यसैले चाहिँ मिडियल रोटेसन अफ आर्म सो दिज आर इन्भल्भ इन द एब्डक्सन अफ आर्म सुप्रास्पाइनटस इन्फ्रास्पाइनटस एन्ड टेरिस माइनर is involved in the lateral rotation and the subscapularis muscle is involved in the medial rotation है so इनर्भेसन हेर्छौँ भने so supraescapular nerve supplies the supraspinatus and infraspinatus supraescapular nerve is a branch of the upper trunk of the brachial plexus so it will supply the supraspinatus and infraspinatus muscle and the teres minor is supplied by the axillary axillary nerve that is the branch of the posterior cord and the subscapularis nerve is supplied by subscapular muscle is supplied by the subscapular nerve subscapular nerve is supplied by lower and upper subscapular nerve so this is the lateral rotation है lateral भनेको lateral side तिर लाने हातलाई so medial भनेको medial side तिर ल्याउने so कुनै पनि एंगल घटिरहेछ भने कुनै पनि जोइन्टमा एंगल घटिरहेछ भने अब यो एडक्सन र एब्डक्सन भन्ने चाहिँ कस्तो हो भन्दाखेरि इफ द ह्यान्ड इज मुभिङ सो शोल्डर जोइन्टको रेस्पेक्टमा यो ह्यान्ड इज मुभिङ टुवर्ड्स दि यसरी गइरहेछ है सो दिस इज द एब्डक्सन एन्ड दिस इज द एडक्सन सो आफ्नो बडीतिर ल्याउने आफ्नो बडीसँग एलाइन गर्ने चाहिँ एडक्सन भयो एब्डक्सन भनेको आफ्नो बडी भन्दा अपोजिटमा लाने के सो त्यसरी बुझ न सो एडक्सन भयो सो मैले भनिसकेँ सो सबस्क्यापुलर नर्भ अराइजेस फ्रम द सुपेरियर ट्रङ्क अथवा अप्पर ट्रङ्क and the lower and subscapular so axillary nerve arises from the posterior cord this is the posterior cord posterior cord axillary nerve this is the axillary nerve and the posterior cord this is the upper subscapular and lower subscapular nerve so supraescapular nerve ko root value is C5 C6 because it forms the combination of the ventral rami of C5 and C6 cord so C5 and C6 roots to form the upper trunk so upper trunk बाट आएको हुनाले C5 C6 is the root value and the posterior cord बाट आएको हुनाले यसको चाहिँ C5 C6 posterior cord is made of all three roots है all three trunks भनौँ all three divisions भनौँ divisions of the trunk so it will contain all the root value चाहिँ posterior cord मा चाहिँ all the root value चाहिँ C5 to T1 हुन्छ है पोस्टेरियर कर्डमा चाहिँ तर नर्भ अनुसार चाहिँ यो C5 र T1 कसरी डिभाइडमा हुन्छ भन्ने हो के सो कुनै नर्भमा C5 देखि C6 हुन्छ कुनैमा C5 देखि C7 हुन्छ कुनैमा C7 देखि C8 हुन्छ कुनैमा C8 देखि T1 हुन्छ यसरी डिभाइड भए हुन्छ है सो हुन चाहिँ पोस्टेरियर कर्डमा चाहिँ सबै हुन्छ तर त्यसरी चाहिँ डिभाइड भए हुन्छ सो लोअर अपर एन्ड लोअर सबस्क्यापुलर नर्भ सप्लाइज द सबस्क्यापुलारिस व्हिच द रुट भ्यालु इज द C5 to C7 and the axillary nerve supplies the teres minor there was root value is C5 to C6 यति याद राख है सो ओके अनि लास्टमा चाहिँ एउटा चाहिँ क्लिनिकल रिलेभेन्स है सो क्लिनिकल रेलेभेन्स regarding shoulder joint है regarding shoulder joint है सो मैले अहिले पनि भनेको थिएँ सो त्यो shoulder joint लाई चाहिँ superiorly it is covered by the coracoacromial ligament and the that forms the coracoacromial arch and the muscle tendons also covers the shoulder joint superiorly there is a strong covering Superiorly, there is a strong covering of the shoulder joint by the muscle tendons and the ligaments that form the superior coracoacromial arch. त्यस्तो हुँदाखेरि the superior dislocation is not common in case of the joint dislocation. So the inferior dislocation, inferior dislocation of shoulder joint, dislocation of shoulder joint is more common. Joint is more common. So clinical more common. So clinical relevance the inferior dislocation of the glenohumeral joint is more common, and the this is the humerus. Sorry, humerus this is the humerus. Okay, this is the humerus, and humerus there is the this is the surgical neck, and this is the anatomical neck, and this is a morphological neck. The surgical neck pachadi, just to surgical neck pachadi patti there is a nerve passing. There is a nerve passing which is known as axillary nerve. This is axillary nerve. This is axillary nerve.
सो एक्जिलरी नर्भ पास हुन्छ सर्जिकल नेट पछाडि चाहिँ है। सो पछाडि पास हुँदाखेरि कहिले कहिले ह्युमेरसको यो नेक फ्र्याक्चर हुँदाखेरि यो नेक फ्र्याक्चर अफ ह्युमेरस है ह्युमेरसको नेक फ्र्याक्चर हुँदाखेरि चाहिँ देयर इज द injury to the axillary nerve. There is injury to the axillary nerve है। there the axillary nerve supplies the teres minor है, teres minor र अझै एउटा muscle that is a deltoid है। so there is a deltoid palsy है, deltoid muscle is paralyzed है। यो पनि एउटा clinical applied aspect भयो है। there is the also त्यस्तै गरेर एउटा मैले अन्य भनेको थिएँ bursa are meant for reducing friction. there is the most prominent bursa in the shoulder joint, that is the subacromial bursa है। subacromial bursa भन्ने हुन्छ कि this is the most prominent or most largest bursa in the shoulder joint है। this is the subacromial bursa and the inflammation of this bursa leads to the subacromial bursitis है। so subacromial bursitis हुन्छ। so subacromial bursitis भएपछि this is inflamed है। this inflamed inflammation भइसकेपछि it is will be painful है, painful है during the abduction of arm, the abduction of shoulder joint है। shoulder joint को abduction गर्दाखेरि it will be painful है, shoulder joint। okay, this will be painful during the abduction of the shoulder joint because there is the inflammation called subacromial bursitis in the subacromial bursa that is present just below the acromion है। यो पनि भयो है। so there is also the rotator cuff tear भन्ने है, cuff tear भन्ने हुन्छ है। कस्तो भन्दाखेरि this is more common with the supraspinatus muscle है, supraspinatus tendon rupture हुन्छ के, tendon tear हुन्छ है। so this supraspinatus tendon is inserted in the superior facet of the greater tubercle है, greater tubercle superior facet मा गएर इन्सर्ट हुन्छ। सब एब्डक्सन गर्दा अथवा कुनै हेभी एक्सर्साइज अथवा कुनै गेम खेल्दाखेरि चाहिँ यो सुप्रास्पाइनस मसलको टेन्डन यो सुपिरियर फेसमा इन्सर्ट भएको थियो। सो दिस इज द टेन्डन इट इज टियर है, चेत्तियो भनेपछि दिस विल लुक लाइक दिस। सो यसरी रप्चर भयो भने चाहिँ दिस इन केस अफ हेभी एक्सर्साइज एन्ड प्लेइङ गेम्स देयर इज रप्चर अफ द सुप्रास्पाइनल टेन्डन। सो द्याट मेक अस डिफिकल्ट टु डु एब्डक्सन है, एब्डक्सन गर्न डिफिकल्ट गराउँछ कि हामीलाई, एब्डक्सन गर्नु पेनफुल हुन्छ है, अगेन है पेनफुल हुन्छ है। सो पेनफुल फ्रम 15 डिग्री टु 60 डिग्रीसम्म एब्डक्सन गर्न इट विल बी पेनफुल है। सो 15 डिग्रीसम्म नो पेन, 15 देखि 60 सम्म पेन, एक्सटेन्सिभ पेन हुन्छ र 60 देखि माथि चाहिँ पेन हुँदैन। सो दिस काइन्ड अफ क्लिनिकल प्रेजेन्टेसन इज क्यान बी सस्पेक्टेड फर दिस सुप्रास्पाइनस टेन्डन टियर है, सुप्रास्पाइनल टेन्डन टियरमा है। ओके, एक्सियल नर्भ एनर्जी भयो। त्यसपछि फ्रोजन सोल्डर भन्ने हुन्छ कि, एउटा फ्रोजन सोल्डर भन्ने हुन्छ कि, फ्रोजन सोल्डर भनेको चाहिँ फ्रोजन सोल्डर भन्छ यसलाई चाहिँ, फ्रोजन सोल्डर और एडिसिभ क्याप्सुलाइटिस पनि भन्छ है, एडिसिभ क्याप्सुलाइटिस। सो यो चाहिँ युजुअली थिकनिङ एन्ड फाइब्रोसिस है, दिस इज द थिकनिङ एन्ड फाइब्रोसिस अफ जोइन्ट क्याप्सुल, दिस इज थिकनिङ एन्ड फाइब्रोसिस अफ जोइन्ट क्याप्सुल है। सो जोइन्ट क्याप्सुल फाइब्रोसिस भइरहेछ भने इट विल बी पेनफुल ड्युरिङ जोइन्ट मुभमेन्ट है, जोइन्ट मुभ गर्नलाई पेनफुल हुन्छ। सो जोइन्ट मुभ गर्दाखेरि इट विल बी पेनफुल है, इट विल बी पेनफुल एन्ड इट इज कमन इन एल्डरली पेसेन्ट्स है, एल्डरली पेसेन्ट्समा कमन हुन्छ है, एल्डरली पेसेन्ट्स। ओके, सो दिस इज द क्लिनिकल और एप्लाइड एक्सपेक्ट है, क्लिनिकल और एप्लाइड एक्सपेक्ट यति नै थियो फ्रोजन सोल्डर एडिसिभ क्याप्सुलाइटिस। सो फर द नेक्स्ट पार्ट है, नेक्स्ट पार्ट डु सब्सक्राइब है।